Type 1 diabetes is a chronic autoimmune condition in which the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. This leads to an absence or severe deficiency of insulin, a hormone essential for regulating blood glucose sugar levels. Type 1 diabetes most commonly appears in children and young adults, though it can develop at any age. Causes of type 1 diabetes. The exact cause of type 1 diabetes is unknown, but factors may include genetic predisposition. Certain genetic markers increase susceptibility, although the presence of these genes does not guarantee development of the disease. Immune system response. Type 1 diabetes is an autoimmune disease, where the immune system attacks the body's own pancreatic beta cells. Environmental triggers. Factors such as viral infections may trigger the immune response that leads to diabetes in genetically predisposed individuals. Other factors. In some cases, environmental factors such as diet or gut bacteria might contribute to the disease process, though evidence is still emerging. Symptoms of type 1 diabetes. Type 1 diabetes symptoms can appear suddenly and are often severe. Common signs include increased thirst and frequent urination. Excess glucose in the blood causes the kidneys to work harder, leading to increased urination and dehydration. Extreme hunger. Without insulin, glucose doesn't reach cells for energy, causing hunger. Unintended weight loss. The body breaks down muscle and fat for energy when it can't access glucose. Fatigue and weakness, due to lack of energy from glucose. Blurred vision. High blood sugar can affect eye lenses, causing vision issues. Fruity smelling breath. This can occur in diabetic ketoacidosis, a serious complication where the body breaks down fat for energy, producing ketones as a byproduct. Diagnosis of type 1 diabetes. Healthcare provider can diagnose type 1 diabetes through the following tests. Glycated hemoglobin A1C test measures average blood sugar over the past 2 to 3 months. An A1C of 6.5% or higher on 2 separate tests suggests diabetes. Random blood sugar test. A blood sugar level of 200 mg/L 11.1 mmol/L or higher suggests diabetes, especially if accompanied by symptoms. Fasting blood sugar test. A level of 126 mg/L 7.0 mmol/L or higher after an overnight fast indicates diabetes. Autoantibody tests. These identify antibodies that attack the beta cells, distinguishing type 1 from type 2 diabetes. Management and treatment of type 1 diabetes. Managing type 1 diabetes requires lifelong insulin therapy, along with monitoring and lifestyle adjustments to maintain healthy blood sugar levels. Key components include 1. Insulin therapy. Insulin must be replaced through injections or an insulin pump. Types of insulin include rapid-acting insulin, used around mealtime to manage blood sugar spikes from food. Short-acting insulin, takes effect more slowly than rapid-acting insulin but still used around mealtime. Intermediate-acting insulin, helps maintain blood sugar levels between meals. Long-acting insulin, provides a steady level of insulin throughout the day. 2. Blood glucose monitoring. Frequent monitoring is essential for managing type 1 diabetes. Finger-stick glucose monitoring, manual testing with a glucometer several times a day. Continuous glucose monitor (CGM), a device that tracks glucose levels in real time and alerts users to highs and lows. 3. Diet and exercise. A balanced diet and regular exercise help maintain stable blood glucose levels. Carbohydrate counting, adjusting insulin dose based on carbohydrate intake to prevent blood sugar spikes. Regular physical activity. Exercise lowers blood sugar, so insulin doses or food intake may need adjustment to prevent hypoglycemia. 4. Managing hypoglycemia and hyperglycemia. It's crucial to recognize and manage the risks of hypoglycemia. Low blood sugar symptoms include shakiness, sweating, confusion, and dizziness. Quick sources of glucose, e.g., Juice or glucose tablets can help raise blood sugar quickly. Hyperglycemia. High blood sugar symptoms include thirst, frequent urination, and fatigue. Adjusting insulin or monitoring carbohydrates can help bring levels down. 5. Education and support. Diabetes education and support programs are invaluable for learning self-care skills, understanding blood glucose targets, and managing lifestyle adjustments. Complications of type 1 diabetes. If blood sugar is not well managed over time, complications can arise, including cardiovascular disease, increased risk of heart attack, stroke, high blood pressure, and atherosclerosis. Nerve damage. Neuropathy. High glucose can damage nerves, especially in the legs, leading to numbness, tingling, and pain. Kidney damage. Nephropathy. Damage to the kidney's filtering system, which can progress to kidney failure. Eye damage. Retinopathy. High blood sugar can damage blood vessels in the retina, potentially leading to blindness. Foot complications. Nerve damage and poor circulation can lead to foot ulcers and infections. Skin and mouth conditions. Infections and gum disease are more common due to high blood glucose. Diabetic ketoacidosis DKA, a life-threatening complication that can result when the body lacks insulin, leading to a buildup of ketones. Advances and research in type 1 diabetes. Artificial pancreas. Closed-loop insulin delivery systems that automatically adjust insulin levels, allowing for better blood glucose control. Islet cell transplants. Experimental treatment involving the transplantation of insulin-producing cells into the body. Stem cell research. Promising studies are underway exploring the possibility of regenerating or replacing damaged beta cells. Immunotherapy. Researchers are investigating ways to prevent the immune system from attacking beta cells. Living with type 1 diabetes. With advances in technology and a better understanding of diabetes management, people with type 1 diabetes can live full and active lives. By monitoring blood sugar, managing insulin, and making healthy lifestyle choices, many people manage to minimize complications and enjoy long-term health. Support from healthcare teams, family, and friends also plays a vital role in managing the emotional aspects of living with type 1 diabetes.